My name is Ian Miller. I'm a clinical pharmacist at Fisher-Titus Medical Center. Prescription drug abuse is the misuse of a prescription medication, either taking one that wasn't prescribed to you, taking it more frequently than you're supposed to, or not how you're supposed to, or taking it for a reason other than you're supposed to, such as if you were prescribed it for pain post-operatively, you would not be using it for a twisted ankle months down the road. Prescription drug abuse is on the rise in our community. It's an issue we see every day in the emergency department, along with other opioid overdoses. People come in, they need Narcan. They sometimes are abusing their family members' medications or abusing their own medication, so it's just a rise on our community. COVID-19 has affected many things in our life, including the rate of opioid overdoses. Nationally, about 30.9% overdose increase from January of 2020 to January 2021, and just here in Ohio, it was about 20.3% increase during that same time period. The most commonly abused prescription drugs are your pain relievers, your Percocets, your Vicodins, your oxycodones, your Oxycontin. Sometimes your oral dilaudid fentanyl patches are abused as well. And then on the other side, you have your sedatives or anti-anxiety medications such as your benzodiazepines like Ativan, Xanax, Klonopin, things along those lines. The link between prescription drug abuse and heroin use, most people kind of start with the opioids that are prescribed, the Percocet, the Oxycontin, the codeine, and they either misuse them, they abuse them, and then they become addicted. And then unfortunately those are a lot more expensive for people to get. Doctors stop prescribing them, pharmacies stop filling them. So they turn to alternative routes such as heroin, and heroin on the street is a lot cheaper than prescription pills. And unfortunately with heroin, you never know what it's cut with. It could have fentanyl, which leads to most of the overdoses we're seeing now. The reasons for prescription drug abuse is multifactorial, but most reasons are either people want to get a good feeling from it, they are looking to relax, they're looking to decompress and get rid of some stress in their life, so they think that these medications can be out for those reasons. If you have a prescription drug that can be commonly abused or misused, one recommendation would be to lock it up if you're not in use, especially if you have someone in your family member who is at risk of abusing it or misusing it, or once you're completely finished with it. So say if you had a surgery and your surgery's over and you still had some Percocet left over from it, the best way to do it would be to drop it off at one of the take-back boxes in Heroin County. Drug take-back boxes are available at each police department in Heroin County. These drug take-back boxes are lock boxes that do not require you to sign or inform someone you're putting anything in there. It's all anonymous. They just don't take syringes or liquids. National Drug Take-Back Day is something put on by the DEA every April and October, and it's a great way to universally collect these medications that are unused. This year in October is the 23rd from 10 a.m. to 2 p.m. and it's a good opportunity for people in our community to come together and take their unused medications and bring them to get them out of our homes.